Hi, I'm Trisha Mae.
Hi, I'm Angeline BERTIZ.
Hi, I'm Maiko Suzuki.
Hi, I'm Arrianne Leonardo.
And today we will be discuss about the
Psychoactive substances and violent offenses.
So, good day everyone. We will talk about the psychoactive substances and violent offenses. So, when we say psychoactive substances, it changes the function of the nervous system and result in alteration in perception, mood, consciousness, cognition, or behavior. Example of the psychoactive substances are alcohol, caffeine, cocaine, and marijuana, and other certain pain medicines. Violent offenses, this is more likely a crime. It includes assault, homicide, murder, robbery, etc. Now, let's proceed to the study regarding to this topic, which is the psychoactive substances and violent offenses. A retrospective analysis of representation to an urban emergency department in Switzerland. So, psychoactive substances can contribute to violent injuries, sexual abuse, and homicide. This effects is demonstrated in some substances. Some of are more controversial like cannabis, marijuana, etc. or very limited like ecstasy. This study aims to gather on the type and frequency of psychoactive substances used in case of emergency department that relates to interpersonal violence. So the method that they use is covered cases of psychoactive substances that lead or relate to violent crimes, more likely cases of isolated ethanol intoxication, suicide attempts, and substance use for medical purposes. So the result of the study shows that 52% is bodily force related to an urban violence is 83%. When we say urban violence, violence interpreted in its sociological sense and as an interplay between stereotype representation and the reality that dangerous classes experience in their environment. The mean patients are 29 years old and 79% of them are male. 63% of the patients use more than one drug. Using alcohol is 60%, using cannabis is 50%, and cocaine 21%. 36% is the total cases of combination of alcohol and cannabis. 23% of the patients were admitted to a hospital and 10% of a psychiatric clinic. Besides to alcohol, cannabis and cocaine were the most reported in emergency department that relates to offense and violence. Psychoactive substances has a possible contribution of violent offenses like sexual abuse, homicides, assaults, etc. Usually, alcohol and illicit drugs are present in both offenders and victim. But in Switzerland, the alcohol is one of the most commonly used psychoactive substances, often with unknown toxicological properties, have been increasingly detected in years. High-potency substances including synthetic cannabinoids and synthetic cannabinoids is more often detected nowadays, causing of the new clinical scenarios with aggressive behavior. Data from Switzerland show that cocaine and cannabis are the psychoactive substances most commonly associated with emergency department because cocaine use is related to aggression. This is supported by controlled studies in humans and post-mortem toxicological record so data that associates cannabis with violence and more controversial. So the level of aggressiveness has been found to be higher in using cannabinoids compared to other substances. In some cases, increasing of interpersonal aggression may be one of the symptoms of the cannabis withdrawal syndrome. But there is an apparent discrepancy between the expected association and the clinical experience. It may include individual differences such as age, a personal history of mental disorder, and or those related effect. There's a limited data on emergency department that relates to violent behavior associated with the use of psychoactive substances. Data from Switzerland are available only from the case crossover analysis from the University Hospital of Lausanne, which the potential impact of alcohol and cannabis use on the risk. It was studied by using a questionnaire. The study aimed to describe the presentation related to violent assaults in association with psychoactive substances. The main objective of this study is to gather data on the type of frequency of psychoactive substances that used in the case of emergency department related to interpersonal violence.
A retrospective study was conducted between May 2012 and June 2016. This retrospective study was approved by the local ethics committee. All the patients admitted to the emergency department at Bern University Hospital were the main subject of this study. Those were the patients who committed violent offenses associated with psychoactive substances. The Bern University Hospital is a primary care facility and at the same time a tertiary referral center of the other hospitals in the area. Cases were retrieved and collected using a comprehensive full search algorithm from electronic patient chart database, and automatically it identifies cases mentioning such as violence, assault, violent conduct, violent offenses, stab, strangle, beat, fight, choke, attack, physical abuse or related terms, including abbreviations and misspellings. Only cases that involve violent offenses and continuous use of psychoactive substances were included in the study. A violent offense was defined as causing physical pain or damage to the another person on purpose, while a recreational drug was defined as a psychoactive compound used for recreational purposes rather than medical or occupational purposes. This study is limited to recreational drugs for recreational activities, cases of isolated ethanol intoxication, cases with substance use for suicide attempt, cases with substance use for medical purposes are excluded to this study, as well as self-harm and self-aggression were not included too, as the underlying factors such as mental disorders, terminal illness, and the dose used can greatly differ from the cases involved in the current study. The patient demographics, the psychoactive substances used and reported by the patient or witness, the route of hospital admission, the clinical effect, and the clinical outcomes are recorded and studied for more information and details to get. And lastly, a urine drug screening test using an immunoassay was used to screen for or such as amphetamines, cocaine, methadone, antidepressants, and tetrahydrocannabinol.
In the result of these 1,945 were related to violent offenses, 1,697 with the affected person as victim and 248 with the affected person as offender. Among these, alcohol alone was involved in 386 instances and psychoactive substances alone or in the combination with the alcohol. In 103 instances, the Table 1 shows the patient characteristics of the 103 cases studied. In 88 instances, The statistics were based entirely on the patient's self-reported use in 6 instances. The patient provides statistics on the substance used of the other person involved in the offenses, in addition to their own substance used in a few instances and in 13 instances. The statistics were derived from the urine drug screening examination. Figure 1 depicts the material in question. Figure 2 depicts the elements mentioned in the exclusive H corporation. Table 2 and Figure 3 shows the indicate ingredients and the frequency in their aggregate in cases where numerous substances are used. A urine drug screening examination was performed in 34% of the occurrences, with the analytical outcome with matching the afflicted person record of 6 to 35 cases, or 17%. Figures 6 and 7 shows the frequency of the items involved in a case of the urban and domestic violence, respectively. The drugs stated in the 3 rape cases were cannabis, cocaine, and at the time, alcohol is 1 to 24 cases, cannabis 10 to 24 cases, cocaine 3 to 24 cases, methamphetamine 2 to 24 cases. At the time, benzodiazepines, heroin, and khat, every 1 to 24 cases were all involved in the situation where the patient was admitted to a hospital ward. Thank you.
The present study described acute recreational drug toxicity presentations at a large urban ED in BERTIZ, Switzerland. Over a 4-year period, which is May 2012 to April 2016, cocaine and cannabis use were associated with the majority of presentations due to acute recreational drug toxicity. These were also the substances that were most frequently detected analytically. In the majority of cases, the patient was male and it is between the ages of 21 and 30 and was brought to the ED late at night on a weekend following an urban violence offense. In more than 1/3 of the cases, the patient's personal history included chronic substance abuse, and approximately 1/5 of the patients were unconscious at presentation or prior to hospital admission. However, most intoxications were of moderate severity and most patients were discharged home directly from the ED. Urine drug testing was performed only about 1/3 of the time, and the most common reason for hospitalization was alcohol use, followed by cannabis and cocaine. According to our findings, cannabis appears to play a dominant role after alcohol in presentations involving violent offenses. Furthermore, because cannabis was the most commonly detected substance in our study, it should be noted that the urine test can remain positive for days or weeks after cannabis use. As a result, a positive result does not always imply cannabis use in the hours preceding the presentation. In our study, self-reported cannabis use was linked to violent crimes in half of the cases, but cocaine in only 21%. Thus, since cannabis and cocaine appear to be involved in roughly equal numbers of ED presentations due to acute drug toxicity, cannabis seems to be more quite often involved in cases involving interpersonal violence. However, in our study, cannabis was combined with alcohol in the vast majority of cases, whereas it is 37 out of 51, which was also the most commonly reported combination of substances. It is unclear whether cannabis, alcohol, or their combination play a role in these cases. While studies focusing on intentional injuries have found synergy between alcohol and other drugs, other studies have found that co-use of other drugs did not enhance the association between alcohol and violent injuries by the patient. Furthermore, the amount and type of cannabis use are likely to have played a role in the development of aggression behavior in some patients. The concentration of tetrahydrocannabinol or THC, the primary psychoactive component of the cannabis that has been shown to cause paranoia in vulnerable individuals, it may be important in terms of aggression development. Low THC doses may increase aggressive behavior, whereas moderate and high doses may suppress aggressive behavior. To investigate this aspect further, we will need much larger number of monointoxications and more information.